COVID-19 continues to disproportionately claim the lives of people of color. I spoke with a local researcher from GSU today on their first day of a brand new study that aims to dive into the black community to learn how best to not only reach them, but also gain their trust.
And there is great diversity within the community.
Dennis Reedy of GSU School of Public Health is tasked with learning about barriers, distrust, and also the motivation behind why some in the black community would get involved with medical research while others avoid it.
And we didn't want to come in and assume that the barriers and motives are the same for one black person as it is for another black or African-American person.
And they're not. SisterLove Deputy Director Lisa Diane White has worked in the community participatory research field for more than 30 years around HIV and sees some similarity with COVID.
The information is fast, it's changing, it's new, and all of these things, build distrust.
While we continue to learn about COVID-19 and work toward vaccines for the public, White says the conversation starts by establishing trust in a community plagued with the effects of racism before trust in medical research can begin to take hold.
We're also dying at rapid numbers, and so we have to look at, we're dying anyway. So who do we trust?
And so my hope is that we can learn some ways to create effective communication strategies that will, in the long run, reduce some of the health disparities that the black community suffer.
The National Institutes of Health awarded GSU a $1.3 million grant to study this for 2 years. The goal is to create effective communication for all ages in the black community to trust health interventions, whether it be for COVID-19 now or something else in the future.
Starting at 5, we are following two big breaking news stories for you.
A busy part of Atlanta.